Why is Health Sciences Institute so focused on chronic care improvement?
Well, it's really impossible to separate healthcare system change, healthcare systems improvement from chronic care improvement. If you look at the numbers, most people who receive services in hospitals, who receive services in other healthcare settings and physician offices have chronic conditions or they're at risk for chronic conditions. In addition, over 75% of healthcare spending in this country can be attributed to care for people with chronic conditions. So if we're going to look at really managing the costs and having the biggest impact on healthcare conditions, that's where we look at is chronic conditions. Secondly, when you look at the safety errors in this country, the errors of omission or the never events, when people receive a service that wasn't intended, the people most at risk for those kinds of events are people with chronic diseases. They're the ones that are interacting most frequently with the healthcare system. So we focus on chronic conditions. We have an acute healthcare-oriented system, and we need to reorganize and realign the healthcare system with the needs of the most frequent consumers, and those are people with chronic conditions. In a lot of sessions, we've had people ask us, well, why don't we just focus on preventing chronic diseases? And you've heard that in a lot of as the candidates have spoken about healthcare reform. Prevention is critical. We have to prevent chronic diseases, but I always like to give the analogy of we have a patient in the emergency room. They're hemorrhaging blood. What are you going to do? Are you going to address the shock or the immediate concern, or are you going to talk to them about their diet and exercise? Right now, we have to stop the hemorrhaging in the system, and that's related to the prevalence of chronic conditions, multiple chronic conditions for many folks. And we have to work with those individuals, patients, to help support healthy lifestyles, and definitely we have to prevent chronic diseases.